I was first told in 2016 I needed a hip replacement. My first reaction was, no, that's not going to happen. I'll go back to MD Health and I'll just keep working on it. But it got so painful that I had to then say, all right, I will have the operation.
People tend to, like, they think, oh, I don't need to do exercise before the hip operation. I'm going to get it fixed anyway. Or like, oh, how can I exercise in this area because it hurts? But you did 3 months of work beforehand around the hip, getting it ready for the operation.
It definitely hurt when I did the exercises, but I was well informed that it's like anything. If you don't use it, you lose it even more.
Hello, I'm Michael Dermansky and you're listening to The Confident Body Show. It's a pleasure to welcome Jane Normoyle, who's joining us today to talk about the importance of preparation for a hip replacement. Jane, welcome to the show.
Thank you, Michael.
I've known you since you one day during I think it was a Saturday or Sunday, walked into a clinic at one of our first clinics at Templestowe. And we've seen you through different things since then. Just tell the audience a little bit about yourself as well. The kids you have, any grandkids you have, how many, what kind of work you did, and where you are in your life at the moment.
All right. I'm 72. I have 4 children and I have 10 grandchildren that keep me very busy lifting them and playing with them. So fortunately, Michael has been here to keep me strong.
Well, we're going to talk a very specific part of your journey in your life. And we're talking about the importance of doing strength work before any hip surgery. So you've had 2 hip replacements now. The right one was in 2016. And
Yes.
then, and the left was just earlier this year, in April this year. Let's go back to the first one a bit. What did you first think when you were told you needed a hip replacement?
When I was first told in 2016 I needed a hip replacement, my first reaction was, no, that's not going to happen. I'll go back to MD Health and I'll just keep working on it. But it got so painful that I had to then say, all right, I will have the operation. I was nervous, but eventually it was done, and with a lot of help, I got through it all. And with MD Health, I don't think it would have worked. It certainly worked very well with MD Health before the operation, where I did a lot of work on my legs and afterwards, making me less nervous and able to strengthen my body.
Right. I mean, we worked on it for quite a while. How long was it roughly from when you were told? I know it's a while ago. How long roughly was it when you were told you need a hip replacement to like, no way, and then to, okay, it's time?
It was probably about 3 months before I actually said, all right, my very old dog who was 16 could walk faster than I could. And that made me realize, okay, now is the time.
Right. And I guess it's not just a matter of like, it's either physio or strengthening work or surgery. It's really a combination of both. Like, when is it time where the physical work you're doing isn't enough to, okay, this needs to be done, but it's not one or the other. It's often both. Is that right, Jane?
Yeah, it's a combination of both. It's a combination of the brain saying yes and going with the thoughts it's got to happen. And then doing the physical part of it, working with your legs or whatever part of the body it is to prepare for that. And I think I did 12 weeks or so of really strong, steady preparation for the operation.
Right. Well, before we get into that part of the operation and so forth, tell us about the story about the second one, because you didn't know you had a hip issue. So tell us of that story as well.
The second hip, no, I didn't realize I had an issue. I knew it was a little bit sore and I kept coming to MD Health and they'd do some work on it and it'd be a little bit better. And then eventually it got to a point where I thought I better go and see a surgeon. He said, oh yes, you've got osteoarthritis. I can do the operation. And I said, let me think about it. Once again, I thought about it for about 3 months and worked at MD Health very steadily on the hip to get it strong, and then eventually had the operation.
But I mean, for you, like as you're telling me, that was mostly a knee problem. You thought about this knee issue, and then you were a bit surprised when you were told, like, oh, it's a hip problem.
Yeah, initially I thought it was the knee, and then I thought maybe it was the back. But no, I was surprised because it actually presented very differently from the first hip. The first hip was very different pain in it and in a very different place.
Yeah, it's amazing as well. It can be very different too. The funny thing is, with some hip issues as well, sometimes no hip pain whatsoever. And the knee is a common referral site to hip problems as well. So people come to see us and they say, knee pain, it's knee pain. And we work on it. It just doesn't seem to get better. And then when you start looking a bit deeper, it's like, oh, this is actually a hip problem. And then you get the X-ray done, surprised, like, okay, this got severe arthritis. And it's funny that you had one then the other. There's often a lot of arthritis from one side and the other, but one is more present than the other side. So you notice the really severe side for a while, and then it's not until you have one done. I mean, yours was a big gap between the two. It was 10 years, but
Yes,
you don't notice the other side until the other one becomes your good side, that you notice the other one's becoming a problem too. We've often seen that as well, where the good side becomes the bad side once you have the hip replacement done, because you start noticing it more. So it's not a
exactly.
shocker when you see the other one done.
Exactly. What was my supposedly good side did get quite sore, but clearly that was my change of gait and just the way I was carrying myself to prevent the pain in the other leg.
Let's go back to the preparation stage. A little bit more detail. What did preparing for the surgery mean beforehand, and then what does it mean to you after the operation?
Well, before the operation, it certainly gave me confidence to know that, well, for a start, that there were people here who cared and would look after me during before and after, and that the exercises that they were given were particularly for that part of my body, which obviously made it much easier to recover.
Yeah, yeah. I know we often hear that people tend to, like, they think, oh, I don't need to do exercise before the hip operation. I'm going to get it fixed anyway. Or like, oh, how can I exercise in this area because it hurts? But you did 3 months of work beforehand. Well, I mean, continuous, but specifically 3 months of work around the hip, getting it ready for the operation the first time around, and then 3 months getting it ready the second time around as well.
Correct, yes.
Was it a problem? Was the fact that the hip arthritis was there a limiting factor for you doing an exercise program for 3 months before the operation?
It definitely hurt when I did the exercises, but I was well informed that it's like anything, if you don't use it, you lose it even more. So I just continued doing the exercises to the best that I could. And clearly, because of the way I recovered, it was a great thing to have done.
Well, what did the recovery look like? What was the recovery? What happened afterwards?
The first one or the second one or both?
Both. Start with the first one, we'll go to the second one.
The first one was probably an easier recovery for a number of reasons, probably because I was a lot younger. But the second one was also relatively easy because I've done all the work. There were times when I thought this isn't progressing the way I want it to, and compared with other people. But I learnt very quickly that you never compare because operations are different for each person. And then I realised that there was also a very big, apart from the physical side, there's a very big mental component that goes with it. So physically I was improving, but part of me was saying, no, actually I can't do this. It will hurt. Or I might dislocate the hip or do something that will hurt it. So my idea was not to. But with coming to MD Health, being told you won't do any damage, this is what we're trained to do, this is the way you will do the exercises, I gained confidence and I started to realise that I actually could walk, and now almost normally.
Well, we're literally just about 3 months into the operation too, the second
Here
operation
we are,
too.
yes.
Yeah, and so, I mean, we'll go back to the first one, we'll go back to the second one too. So what was the hospital stay like the first time round? How long were you there for? What did the first few days feel like? And what was it like when you went home?
I was in hospital, I think, for 4 or 5 days for both of them. And then
Yep.
I went to rehab, which was very good. The exercises were good. But once I came home and came back to MD Health, that's when I really started to improve. Because apart from giving the exercises, you also had the care factor and being told, you can do this won't damage your hip, you won't dislocate it, you're doing the right things, and you really are improving, that you could see the improvement even if I couldn't.
Yeah. So it wasn't just the physicality of the exercise, it's just the fact that we had confidence that you could do it, gave you confidence that you could do it, so
Exactly.
that you would then give it a go, and then the outcome was you got better.
Absolutely. I was doing more, and I was then And I was happy doing more because I knew that was a safe thing now that I could do.
So it's interesting you say that too, because as health practitioners as well, we think about the physical side often, that, our aim is, this is what you can do, this is what our limitations are, and this is where we need to push you a bit more. And then from a patient or a customer point of view, how important that transfer of confidence is from us to you makes such a big difference in your recovery. That's really interesting to see, and it's often overlooked by us. We don't often see that part of it too, but it's very interesting, that transfer of confidence, how important it is.
And I think people who don't come to something like MD Health miss out on that they might just go home and do the exercises themselves, but they wouldn't know quickly enough how they can progress and make things a little bit harder for themselves. And they might be more inclined to say, well, it hurts today, so I won't do it. But I didn't have that because I was coming here and people were just saying, well, you're going to do it. It was pretty simple.
Yeah, absolutely. And I'm just going to remind everyone what we're talking about today. My name is Michael Dermansky, the Senior Physiotherapist at MD Health, and we're listening to Jane Normoyle. She's our guest in the program today, and we're talking about her experiences around her first and second hip replacement, and really the importance of both doing exercises beforehand, and what it means both physically and psychologically for afterwards, and what the recovery looks like. So just going back a step as well, having the first one in 2016, how did that inform or change your view in 2026 when you had to have the second one done? Did it change your thinking a little bit? Did it give you a blueprint going forward? Or was it, okay, here we go again, this is something different altogether?
It was, well, here we go again, but going ahead with a lot more confidence. It had happened the first time. I'd got through it the first time. So with MD help, it was going to be fine again. And that was how I was looking at it.
Yeah. And then what are the stages? I mean, we were told it's a certain amount of recovery. You'll be told by your surgeon it's going to be this pathway. That's very different when you're living through it yourself. So you went home, or you went to rehab, you went home. What will the next little while look like till we're here 3 months later? So how did your life look in those different stages?
I guess when I first came home, I was relatively tentative. And then I came to MD Health, as I said, and that improved the mental side of it. And now I feel I'm pretty much doing what I want to do. I can play with my grandchildren. I can walk a dog. I can come here and I'm confident in doing things. I'm confident again in walking.
Great. Okay, fantastic. I'm going to go back to the mental side of the preparation as well. Would you say what was probably the most important part to you, the physical side or the mental side? I mean, I know they're both part of it too, but again, we don't see this part as practitioners. It's really not on our radar. We talked about the physical side of it as well. What would you say was the most important part?
The surgeon wouldn't talk about the mental side of it all. They'd only talk about the physical side. When I went back for my after 8 weeks, the first hip, I don't really recall being particularly conscious of the mental side of it, but I think just through a lot of reading, coming here, different things, I became aware that things that I was doing or wasn't doing was mainly, it was in my head that I couldn't do it, not that I couldn't do it as such. It was a mental approach that had to be changed. And I think my husband, if anybody, also said, come on, you can actually get up all these stairs now. You can actually do this. And so I did.
Fantastic as well. Jane, is there anything else you want to tell listeners as well in regards to being ready for surgery? When is it right time? When is it the wrong time? When was it, when did you know it was time for you to say, right, I need to have this operation? Because often we're taught the dichotomy of it's either physio, or if it's failed, then you'll have a hip replacement as well. When was it time for you to say, okay, I've done physio?
The first one I knew when I could no longer walk very far without having to stop. The second one I knew, I guess probably because I'd already had one done, that it was time that would make my life a lot easier if I just got in there and got it done. I don't think there is such a thing as a correct time for anybody. I don't think people can say you're too young, you're too old, not yet. It's a matter of how I think the patient actually feels. And when that patient is ready, that's when you'll get the best outcome. because they've actually taken themselves to the table, so to speak.
Great. All right. I know we spoke to one of your orthopedic surgeons, Andrew Chia. He talked about that it's a conversation piece between the patient and the doctor. It's not about you have to have it done or, or it's about when it's time it's affecting your life.
Yes.
That's the time to get the operation done. When you had your hip replacement, either one of them, did you feel pressured by anyone to have an operation done, or was it your choice to say, this is my trigger?
No, it was my choice. No one pressured me one way or the other. The surgeon said, come back when you're ready. And MD Health certainly didn't put any pressure on me to have one.
Great. So, I mean, this is what a really important thing for you, I think, to talk about too, and that the doctor's not the one deciding do you have a hip replacement. They've got an option for you for when you need to in your life. The physios aren't saying not have one or have one as well. It's really about the person. And unfortunately, no one can tell you the exact amount. You have to have this done. It's like, okay, when it's affecting your life that you can no longer have the life you want to have because of this issue, then it's time to have that conversation and think about it too. And I think it's really important for everyone to know when is the right time to have a hip and knee replacement. As you said, it's not always age. It's not always, because the x-ray shows you have some arthritis, you have to have it done. It's about
Quality of life.
It's a quality of life, and the whole point of this is to improve your quality of life. Now, these days, these hip replacements will last, and I went to a presentation on Thursday, is that there's a failure rate of these of 1% a year. So if you have something done now, there's a 30% chance that in 30 years from now, that you may need a revision done. So in 40 years from now, there's a 40% chance that you'll have to have a revision done. So these things are going to last a long time, and the better the materials get, the longer these things last. And so, as you said, too early, too young, too old. It's really about when is it time that's affecting your quality of life. And then, sometimes people put these things off longer than they should. They think, I have to wait as long as they possibly can. Well, this is going to last a long time. And if you're waiting for 5 years to have a better quality of life, well, do you need to be waiting that long? Is it sometimes is it better to get done earlier to have the life you want rather than the ideal time, whichever that is as well?
I'd agree with that. Certainly with the second one, I started to think about, well, I'm already 72. If I wait another 5 years, well, I don't know how long I'm going to live, so I might as well get it done now. I'm ready to have it done, so let's do it. And it certainly has proved to be correct.
Right. So the last question I've asked today, if someone is getting prepared for surgery and they're going to have a hip or a knee replacement, what are the key things do you think they should be aware of and they should be prepared to?
Well, I guess the obvious things, the things around their home, making sure there's someone to look after them, food, all those types of things. But more than anything, making sure that they're doing exercises, going somewhere where someone will support them in their pre-op and their afterwards.
So that's also something important to note as well, that be prepared for the afterwards as well, because you're going to need help. So, you can't just, I have a hip replacement today, I'll be out of hospital in 4 days and everything will be fine. There is a process afterwards. You do have to be prepared for this stuff. Someone has to help you out. You may not be able to. There's a certain period of time you can't drive for. I think if it's a left hip, it's about 2 weeks. If it's a right hip, it's 6 weeks. So you got to be safe as well. So you got to have all that prepared.
Yes, it's not something you just walk into and say, I'm having it tomorrow. You've got to have a lot of thought with it.
Yeah, absolutely. Jane, well, thank you so much. You've been a great guest on our program today, and we've been talking about the importance of preparation for hip and knee replacements. And it's really good to pass on this information so that everyone knows when is it time, when is it not time to have it done, what happens if you do the prehab properly, particularly the transfer of confidence to make sure that people afterwards are confident to do things they are able to do, and being prepared for afterwards as well. My name is Michael Dermansky. I'm the Senior Physiotherapist at MD Health, and it's great to have everyone's company for this presentation. Thank you very much, Jane.
Thank you, Michael.